Well, hi there. Welcome back to the Natural ADHD Solutions Facebook Live Summit. And for our next guest, we brought in Maria Rickert Hong. She's a health coach and an author and probably a number of other things you could throw in there title-wise. And I'm going to let her tell us about herself, introduce herself. And I appreciate so much you taking your time to be with us and share. I know what we're going to cover is some really important topics that parents should really know about when they're dealing with kids, who have ADHD and other neuroprocessing symptoms. Mm-hmm. So, without further ado, why don't you introduce yourself to us? Tell us a little bit about your story of how you got to be doing what you're doing, and then also what you do today.
Okay. Well, thank you for having me here. I really appreciate it. I am Maria Rickert Hong, and like you said, I'm a health coach, and I help parents recover their children from symptoms of autism, ADHD, and sensory processing disorder. I got into this because of my own children, and I've written a book called Almost Autism, Recovering Children from Sensory Processing Disorder, a reference for parents and practitioners. It's really about my own journey with my sons. My older son was more affected, and my frustration with the Western medical system. My son had so many different problems. He had failure to thrive. He had projectile vomiting. He had, hypotonia on top of the sensory issues. He didn't walk until he was 20 months old. He had, asthma, eczema? It's just, chronic constipation. The litany of things. And he was like on 10 different medications. And I'm like, this is insane. And it wasn't getting any better. And it was really only until I started working on myself, because I was so stressed out because of his really chronic tantrums and crying. And he was really kind of inconsolable with the sensory issues that it sucked the life out of me. And I developed shingles twice. I had uterine fibroids. I had ovarian cysts. I developed middle of the night insomnia, bronchitis, all within like a 1 year period. And I finally went to a naturopath and really started learning what are the root causes of not only sensory processing disorder, but also neurodevelopmental disorders, which are all those autism, ADHD, sensory processing disorder that I was talking about. And from that, I recovered him. And it's taken a lot of work, very much worth it. And he is now in 8th grade. He's on the honor roll, and he's doing really well. So I'm really happy with that. And after I had done that, I signed on with Epidemic Answers, which is a nonprofit. It's a 501c3 nonprofit founded by Beth Lambert, who is the author of A Compromised Generation. And it talks about, why so many kids are sick these days. Over 50% of children have a chronic health condition, and nobody seems to think that this is a problem. It's the new normal that you walk into the nurse's office and you have a wall full of EpiPens and another wall full of inhalers, not to mention nut-free classrooms and nut-free cafeterias. And then the numbers of special ed kids just keep mushrooming, and nobody seems to be wondering what's going on. It's like, okay, well, that's what it is, and we just have to deal with it. So I really began digging, and that's how I wrote my book and why I wrote my book. Because from learning from my naturopath and then taking it on from there, just learning what these root causes are.
Gotcha. Yeah, well, that's quite a story. So he's in 8th grade now, mm-hmm. honor roll. Mm-hmm. How about, if we met him today, would we experience that he had some sensory processing or any of those things, or would we be like, it's just an average kid, or that type of thing?
I think you'd probably think he's your average kid. He's not a sporty kid. He never was. But yeah, he's got a great sense of humor. He was in the school play. He writes for the school newspaper. So I think you'd think he was just a kid, not with the sensory issues. And through my work with Epidemic Answers, I came to learn that just because there's a label that he had sensory processing disorder, doesn't mean that he couldn't have the other diagnoses. I mean, it wasn't autism for sure. And that's why I wrote my book called Almost Autism, because there's so much overlap there. And I know you're talking about kids with ADD and ADHD, and there is a lot of overlap there between kids that have sensory processing disorder and also ADD and ADHD. I would say if your kid has those diagnoses, definitely look at the sensory issues and some of the underlying disorders, and root causes.
Gotcha. Yeah. And I want to jump into that in just a moment. I did want to ask you also, tell us a little bit more about Epidemic Answers. What you said it was a nonprofit, but what do you guys do? And what is your role in that too?
I'm the media director. I'm also a board member. And what we do is we let parents know that recovery is possible, not only from autism and ADHD and sensory processing disorder, but also allergies, asthma, autoimmune disorders, mood disorders. Our website is www.epidemicanswers.org. And what I do as a media director is I host monthly webinars, just like you're interviewing me. I interview other people and some really top-notch people in the field about some of these health conditions. We have recovery stories on our website. We also have a really great library of pages that we've put together for all sorts of different diagnoses that your child may have. And I think as you read through them, you'll kind of understand that the root causes for all of these disorders are pretty much the same. It just depends on what kind of exposures that child has had. It's not necessarily so much about the genetics, which is what, all these big researchers, March for the Cure or Race for the Cure are talking about. Everybody wants the silver bullet, but that's never how you're going to get your child better, because there's never one thing that caused it, and there's never one thing that undoes it. And the nice thing about Epidemic Answers too is that we are the sponsoring nonprofit of the Documenting Hope project, which is was originally going to be a docuseries that would take 14 children with autism, ADHD, allergies, asthma, juvenile rheumatoid arthritis, mood disorders, I think, and type 2 diabetes, and have them work with a health coach, integrative practitioners. They would get free organic food, any kind of testing that they would need, usually sort of functional test or and whatever it takes basically, and document what is done for over a period of 18 months, and then just show that recovery is possible, right? And it's actually expanded into much more, because Martha Herbert, who's an MD, PhD at Harvard Medical, is the executive medical director of the program. And so now it's actually digging into the research. And so now we have IRB approval for our CHIRP study, which is actually a 900 question questionnaire that really digs down into the minutia of a child's health history and comes out with this very detailed report that the parent can then bring to a practitioner, and it flags those red flags that may have been missed by a lot of pediatricians. And this is sort of my frustration in all of this. It's like, my child had chronic acid reflux, chronic constipation, failure to thrive, low muscle tone, the sensory issues, food allergies, food sensitivities, all these things are red flags, but they're not getting caught. They're just being medicated. And then we're also coming out with what's called the FLIGHT study. I can't remember what the acronym actually stands for, but it is really that documentation of those individual pieces and parts of what it takes to recover the child. Because as you know, the way science works is that if you look up scientific studies on PubMed, you're going to find one thing that's looking at one thing. So do people with rheumatoid arthritis benefit from taking vitamin D? Something very specific like that, but they're not looking at the whole multifactorial issue that's out there. And that's really it's a very lofty goal, but it's what we're setting out to do with this.
Awesome.
Yeah.
And so, where is the project in that process? Like how far would we as the general public be from, sort of being able to learn more about it or see what the results are, or that kind of thing?
Well, you can go to the website ADHD.com. There is a trailer there. We haven't selected the kids yet, if that's what you're asking. And, because the CHIRP study is what's originally going to be used as a screener tool.
I see.
Is that parent willing to sit down and answer 900 questions
Right.
and really dig back into that child's health history? Because that shows a commitment. How willing are you to be able to recover your kid? If you're willing to answer these 900 questions, then, that's a pretty good thing. So.
Yeah, a good start, a good sign.
Mm-hmm.
Well, yeah, so that sounds fabulous. So then you also, I know, are a co-author of a book that's going to be released soon.
Yep.
Brain Under Attack.
Yes.
I guess the rest of the title is a resource for parents and caregivers of children with PANS, PANDAS, and autoimmune encephalitis.
Mm-hmm.
I'd love for you to tell us a little bit about that. From my experience in the sort of the online world and with parents and working with parents in the ADHD, autism world, I've come to realize that PANS, PANDAS is a very, not very well known, but potentially significant situation that a lot of these kids could be, dealing with. So I'd love for you to just kind of walk us through that as if we know nothing about it.
Absolutely. I do that all the time, so no problem. All right. So, PANDAS is what you may have heard some about within the past couple of years, because there was a documentary that came out called My Kid Is Not Crazy, right? And so PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with a Streptococcal Infection. PANS is the larger umbrella, and right now the acronyms and the definitions are sort of being bandied about. Is it an infection? Sometimes there's an environmental trigger that can cause this, but PANS is Pediatric Acute Onset Neuropsychiatric Syndrome. And so the original title of our book, which wasn't very nice, was called Suddenly Crazy, because that can describe how a lot of these children present. Like all of a sudden they stop eating, they have temper tantrums, rages, tics, anxiety, OCD, bedwetting, very unusual sudden onset kind of things. Lyme disease would fit under the PANS umbrella. And what we're finding out, or what we have found out, because it was co-written with multiple people, right? So there's Beth Lambert, there's me, there's Jennifer Jister-Kozik, Roseanne Campana-Hodge, and then Lauren Stone. And we all look at it from different angles of PANS, PANDAS, and what's going on with these kids. And a lot of very knowledgeable practitioners understand that a lot of kids with neurodevelopmental disorders, autism, ADHD, and sensory processing disorder, do have PANS and or PANDAS. And just because your child has PANDAS doesn't mean that they couldn't also have Lyme disease or viral issues. And the problem I find with, let me go find a PANDAS literate doctor or a Lyme literate doctor, is they're just looking at that one thing. We call it whack-a-mole. And they're not looking at the whole person, right? And so they may go after the strep and hammer it down, trying to kill the strep with loads and loads of antibiotics, and sometimes for years on end, which I personally don't agree with. And you can read my story in there. And it's not catching all the other things, the viral issues. Is it you have a child there?
I do. You know what? I'm just going to.
And so what we need to realize is that a lot of these kids may have PANS and or PANDAS and or Lyme disease and or viral issues. And that was my point in writing my piece, is that there is commonly an underlying herpetic virus, something like cytomegalovirus or Epstein-Barr virus or human herpes virus, 1, 2, 6, whatever. There's a large number of them that are really there because of the toxicity that is in a child. They feed on the toxicity, and then the bacterial infections come in on top of that. And the whole thing gets exacerbated during times of stress. What happens with these kinds of infections is that there is a blood-brain barrier breach. And the blood-brain barrier can be breached by things like antibiotics, which is why I don't really agree with the whole antibiotic approach, because it's just making the whole thing worse in the long term. Electromagnetic frequencies, toxins, including vaccinations, ultrasounds, and traumatic brain injury like concussion. And so those are the major ways that the blood-brain barrier is breached. And when that happens, the infection goes to the brain. And so the story of my son was that, he was fine when he was in the freeze program at preschool. And then when he started the FORS program at preschool, all of a sudden I couldn't do drop-off anymore. I had to pull over into the parking lot and then bargain with him and beg him and try to get him to go into the preschool. And I would have to stay there for 20, 30 minutes. And I didn't have to do this the year before. And he had previously been a very, very happy kid. And all of a sudden he had a lot more rage to him. And I didn't catch it. And you'd think I know all this kind of stuff. And it didn't get caught till a couple of years ago when he was having one of his rages. He had been very angry at a friend, came home, slammed the door, went upstairs to his room, slammed the door, and then came downstairs and he had pulled a big chunk of his hair out. I'm like, something's going on. And so there are tests that can be done for this, but our point in the book is that you can have the test to maybe support the diagnosis, but it's really a clinical diagnosis. So just because those tests, excuse me, like the Western blot, or the Cunningham panel or the anti-streptolysin test, just because they're negative doesn't mean that your child doesn't have it. It's really up to the clinician to decide, based upon the symptoms that they're seeing, if your child does have PANS or PANDAS. And also our point in the book is to lay out a different way of looking at it rather than just the standard treatment of antibiotics. Could be IVIG, which is immunoglobulin intravenous therapy, which is very expensive and invasive, and God knows what's in there. Right? And then at the worst part, it could be plasmapheresis, which is, even more expensive and invasive. So, but there are many, many other ways to look about supporting the immune system of the child. And so what we're really looking at with all these neurodevelopmental disorders, and it's been playing out in the research and being supported in the medical literature that's come out in the past few years, is that we're really looking at neuroimmune disorders. So we're looking at the whole health of the child, and that's where, why I say that you really can't just take that one pill or whatever and think that everything will be fine. Really
sort of like you're saying that the infection or the process that goes on in the brain is a symptom of something bigger going on or something else that needs to be addressed. Is that a good way of looking at it?
Yeah, I mean, I look at it as there are toxins typically in the body. Our kids are being born pre-polluted. The Environmental Working Group had written about this in 2005 with a publication called Body Burden, the Pollution in Newborns, and they found that there was a total of 286 different toxins in kids today, and an average of 200 in a newborn, which means that it came from the mother. Right. And pediatricians are not catching this, that it's being passed from the mother to the child. I mean, I went to my own pediatrician at the time. She's like, you don't live in a toxic waste dump. And I'm thinking, lady, you don't understand, because I had a heavy metal test done for myself, and then I had one done for the kids. I was off the charts with lead and mercury. My older son was at the 97th percentile for heavy metal toxicity. My younger son was at the 90th. I mean, it's incredible. Yes, we are living in toxic waste dumps, and it's being passed from generation to generation because each generation is not detoxifying.
Mm-hmm. Mm-hmm. Yeah, wow. So now we kind of get a sense of what we're talking about with the PANS PANDAS situation. And so you mentioned those. So how do you find somebody if the tests themselves maybe aren't that reliable or aren't necessarily going to tell you one way or the other?
Right.
Are there lots of practitioners out there that are familiar with the clinical aspect of it? Not so many?
Not so many.
Mm-hmm.
Yeah. We do have on our Epidemic Answers website a practitioner directory, and you can search specifically for PANS, PANDAS in there to see if there is somebody in your area. A lot of times even if these practitioners are not in your area, they will do phone consultations.
Mm-hmm.
So
Okay.
that just be aware though that a lot of them do not take insurance.
Mm-hmm.
So.
And so what are the things to look for? What might indicate this is a direction to explore as a parent?
Well, the true definition is sudden onset of symptoms, but in my case, and I would say that, and in a lot of cases that I've heard of, there can be a very gradual onset. So, suddenly if there's a certain onset of symptoms, especially tics, like a motor tic, eyelash pulling, eyebrow pulling, hair pulling kind of thing, trichotillomania, that would certainly indicate that. Anxiety, but what kid today does not have anxiety,
Right.
especially OCD, obsessive compulsive disorder, ODD, which is oppositional defiant disorder, the lazy man's diagnosis. But a lot of these kids have aggression. They have rages. And, rather than putting your child on any kind of psychotropic medication, which is actually what I believe it's the National Institute of Health recommends, to put your child on antipsychotic medication, things like antidepressants. I think, there are black box warnings on there, especially for children. What are we doing to their brains? And so I would rather look at the root causes.
Gotcha. So, I mean, it sounds like then certainly if you have a sudden onset, sudden change of behavior in terms of in those directions you mentioned, certainly that's something to look at, but perhaps it's something to even consider if your child has any of those type of things you just mentioned, even if they've been more of a gradual onset, at least to potentially rule out or to find out, if that's what's going on.
Right.
So you mentioned, did you mention the Brain Under Attack website? Is that what you just mentioned?
Not yet. Yeah.
Okay.
So
yeah, why don't you tell us about that?
So the book itself is not quite out. We're still in the final touches of editing, but there is a website that you can go to. It's www.brainunderattack.com, and you can find out more about pandas there. You can also sign up for the newsletter, and if you do, you'll actually get the Epidemic Answers newsletter, but you'll certainly find out when the book becomes available.
Awesome. And we'll put those links that you've mentioned and any others we talk about in the comments below here for people if they're driving or, on their phone and they can't write them down. So,
okay.
So we'll definitely do that. And so that being an important step, it sounds like for certain, like we just mentioned, if they had the sudden onset or even aside from that. And I know you wanted to share and we talked about some other important things to consider and steps to go through as a parent when you're either finding or have known your child is dealing with the symptoms of the sensory processing or ADHD or in the autism spectrum. So why don't you tell us what are some of the other steps that you recommend people or things they get checked out to make sure we know what's exactly going on with our kids?
Yeah, the biggest thing I would say to get checked out is vision. And vision is not, can you see 20/20 and can you read those numbers and letters on the wall? Vision is how does your brain process what it is seeing? And vision actually takes up the largest bandwidth of processing power in the brain. And so if vision is off, you get compensatory effects from the other senses a lot of times. And so vision, you would go, if you wanted to have the vision checked out, you would go to a developmental optometrist, also known as a behavioral optometrist. They are known as ODs. And you can go to the website COV as in victory, D as in dog.org, and you can find a developmental optometrist. Just know that not all of the optometrists listed on that site are specializing in kids with neurodevelopmental disorders. Some of them actually work with athletes to improve their vision. But what happens a lot of times with these kids, there's been neurological damage that's happened in the brain, whether from toxic assault or from pathogenic assault, usually both, and it affects a certain part of the brain. And you may see that a child has a bit of a strabismus where the eye turns one way and the other. I think I have a little bit of one actually. One eye goes one way and the other eye kind of goes the other way, which, if you have a concussion, that's actually one of the first things that the neurologist will check out. He'll take a look at your eyes, and are the eyes teaming and tracking together? And if they're not, there's a convergence disorder. So a lot of these kids actually have double vision. The test for vision will actually take maybe an hour and a half, depending on the practitioner. And it really looks at how well the eyes work together. And if they find out that your child does have a vision issue, then you would work with a vision therapist typically once a week. A lot of times it is covered by insurance, which is nice. And then you would also do exercises at home, maybe 3 to 4 days a week for about 15 minutes a day. It's really not that bad. And it's really kind of interesting to learn how the brain works. But it can help with things like focus and attention and stamina, reading comprehension, obviously, but also things like, just overall academic performance. And then when you correct vision, because those other senses are not having to compensate for vision, then you might all of a sudden find out that your child becomes more verbal, right? Because that part of the brain is more freed up. Maybe the hearing gets a little bit better. Maybe the allergies and the asthma and the eczema start to lessen a little bit because the body is no longer as stressed. So we're really looking at what's called the total load theory, is to try to take away those bigger stressors as soon as we can to allow the body to heal, because the body does and can heal if it is allowed to.
So it's more than just that they're having difficulty processing visual input. I mean, because that certainly can be part of it, the symptoms we see of inattention and difficulty, in school and that type of stuff, but also that just having that difficulty is putting a load on the whole system.
Yep.
That's what you mean. And so other things can suffer as a result.
Yep. Is she there?
Yes.
Oh,
there she is.
Hi.
Uh-oh,
somebody got into the ink.
Yes, well, her sister was decorating her for Halloween. So,
Hello.
but, okay, so that's why I've been looking to the side, everybody who's watching this. She's here with me today. Her mom is a doula, and she's out of birth, so.
Oh, that's fantastic.
She came to the office with me, and she's trying to climb on something that I'm afraid will get her hurt, so.
Okay. Well, hang on.
Okay. So great. So that's a great second step, I guess, depending on if we go with the evaluation for the pandas. Mm-hmm. And then I would imagine that other senses also. I mean, like is it true same for hearing and mm-hmm. other senses?
Yeah, hearing is probably the sense that is probably next most affected. And if you have a child with ADD, ADHD, I would certainly get that checked out. It's not always going to be caught by the hearing test that you go to when you go to the pediatrician, right? The way we checked it out, it was actually to go with a specialized speech and language pathologist or therapist who works in conjunction with an auditory therapist. So the SLT actually tested my son for different frequencies. And for some, he was hypo, like he couldn't hear certain frequencies very well. And so that would be the parent that would say, well, my child never pays attention when I call his name or whatever, or the teacher, right? And so the kid's just not paying attention in class. Well, maybe he literally can't hear you, but then they might be hypersensitive to certain things as well, certain frequencies. And so I've worked with parents who have kids that are really hypersensitive to the sounds of the butterfly wings flapping. It's like deafening them. So, and so you can do auditory therapy to help correct that as well.
Okay. So, well, that's amazing. Butterfly wings flapping is loud.
Yeah.
So these are both, or all of these still, though we're talking about there's not some hearing or visions, I don't know if deficit's even the right word. It's something that where the system is overloaded and it can be corrected with mm-hmm. different types of therapy.
Yeah, you're just looking at creating new neural pathways, right? And so think of somebody that's had a stroke, right? What do? They go to rehab. They have to learn how to walk again or learn how to use a spoon or whatever. And so The difference is that this is with a child whose brain is still developing,
Mm-hmm.
and you have to really make deeper grooves to go back and recorrect those grooves that should have been there because they were damaged.
Gotcha. And does it, well, so then I know after, so vision, so pandas, vision processing, auditory processing, and then there was a fourth one you had mentioned previously. So what was that?
Primitive reflexes.
Uh-huh.
So a lot of times, a lot of our kids will go to occupational therapists, and that's a good thing. And a lot of them do specialize in sensory issues, but there's something really more fundamental that needs to be looked at, and those are primitive reflexes. And so pretty much any kid that I've seen that has a neurodevelopmental disorder has had some kind of developmental delay, right? And typically that means that there is going to be a retained reflex. And so what that is there are certain primitive reflexes that are just programmed into the way that we develop both in utero and as babies to emerge at a certain period of time of development and then become integrated. But what happens with kids with neurodevelopmental disorders is that some and a lot of those reflexes are never fully integrated. And so they are retained, and that can cause all sorts of things, especially academic issues, but coordination issues, balance issues, free-floating anxiety, just depending on what the level of the reflex is. So one of the major ones for my son was that, I would take him swimming when he was a baby, let's say 2 years old or so, and he couldn't swim like this because he had an asymmetric tonic neck reflex.
Uh-huh.
And it means that the front half and the back half of his body were not coordinated. He never cross-crawled. He never crawled on his hands and his knees, which is a very, very important step for wiring the senses of vision together with the whole body and the whole nervous system. So this whole thought of ADD, ADHD, sensory processing disorder, autism being only in the brain is wrong, honestly. It's a full body kind of thing. And so after doing certain kinds of reflex integration exercises, and actually there's a specialized aquatic kind of swimming that can be done. He was able to float like this and, keep this integrated. Because, as a baby, before they start to cross crawl, they have to sort of learn to push off with their back legs and feet, right? So he never did that. He army crawled until he was 19 months old, which is a big developmental delay.
Right.
He only cross-crawled for a few weeks, and then he walked when he was 20 months old. And, it's a common thing that I see that a lot of these kids, they butt scooted. It was cute. And it's like, yeah, but it means that there's like something going on up here where it's not working correctly. Or, my son crawled backwards for the first couple of months instead of being able to crawl forwards, even just on his tummy. And he couldn't crawl on his hands and his knees because he didn't have the muscle tone to be able to do that, which is the whole hypotonia thing.
So is there some specific or obvious cause for these things to not integrate? Or is it kind of like part of the same story where there's a number of things that could cause that to happen?
Usually there's some kind of neurological assault. And in my mind, it's usually from heavy metals, heavy metal toxicity. A lot of times, this is the dirty word, it's vaccines that can cause it. In my son, it actually happened when he was 3 months old. And I didn't catch it at the time. I'm a new mom. I don't know what to look for. He was perfectly strong, and he was 3 months old, and you could stand him up against something, and he was so strong he could stand up, or you could sit him up against something and he could sit up. At 3 months old, which is very unusual, but fast forward to 6 months old, he couldn't sit up by himself, and then he couldn't crawl. He crawled backwards, and he lost muscle tone, and it was just, if you look on the vaccine insert, a lot of those adverse risk events will say things like encephalopathy, which is the swelling of the brain, which is really what we're talking about in the title of the book, which is PANS, PANDAS, and autoimmune encephalitis. And so one of the things you also want to look for is, did the circumference percentile of your child's head grow, especially during the first 2 years of life? If it went from a 50th to a 75th percentile, that's a big red flag that there is some kind of inflammation and encephalitis going on. And this was pointed out in the journal Nature just a couple of years ago. It's something to look for, but most clinicians don't know to look for this.
Mm-hmm. Gotcha. So then you mentioned, so there's exercises to integrate the primitive reflexes that are retained. What type of practitioner typically would you tell people to look for to help with that?
There are different kinds. You can find some on our Epidemic Answers website. Somebody that does the Muscatova method, which is the Muscatova Neuro Reflex Integration, MNRI. That's a really good one to know. Brain balance centers don't look at all of the primitive reflexes, but they do look at about 12 of the major ones. And so the Blomberg rhythmic movement would also be another one. There's a woman named Sonia Story who does moveplaythrive.com. She has videos and classes that she does online, because not every parent has the access and availability to these kinds of practitioners. And honestly, there aren't a whole lot of them out there. But you're going to get way more bang for your buck for, any kind of occupational therapy. And I know a lot of these kids have IEPs for OT, PT, speech, and that's really not going to get you that far, honestly, for recovering your kids if you're depending on the school system to provide services for you. It'll help to some degree, but it's really just for, just the very, very basic level of functionality.
Yeah. Unfortunately, that's the story with a lot of those things, huh?
Yeah.
The basic level. Well, okay, so just to summarize, because we've kind of been or at least I've been a little distracted by my visitor here. Yeah, well, she's got that going for her, I guess. That's why we keep her around, right? No, yeah. But, okay, so number one, and what we talked about first, certainly is to assess for pandas, something going on underlying like that. And then aside from that or next is visual processing, because that's really what takes up the most bandwidth in our brain, yeah. And then auditory processing would be next, and then primitive reflexes.
Yes.
Okay, so these are sort of, I guess the theme I see in all of this is they're sort of hidden in a sense, Yeah. They're not obvious. It's not like my child is having trouble, following directions at school, so I take him to someone who will teach him how to follow directions. Yeah. These are sort of more, less obvious perhaps to the outside view or, the objective viewer.
Right. You're going to get much more executive functioning capability as far as organization, time management, those skills that are super necessary once you hit middle school and beyond. If you do all these other things first, and you're going to have a very, very frustrated child when they hit middle school or high school if you haven't addressed these things. And that's why, a lot of these kids are put on medication to be able to help them focus. And so, the problem is that, you're going to go to your pediatrician. Your pediatrician's not aware of these kinds of things. Mm-hmm. But that's why we do what we do. We try to educate people and let them know.
Right.
Yeah.
Well, and obviously a much needed service, that education. And hopefully, as you guys continue and different people continue and your book comes out, more, sort of general practitioners will at least know to send you somewhere to check these things out if they won't do it themselves or don't do it themselves. So that would be great. Well, I really appreciate what you've, brought to the table for our summit and shared, because I think it's so vital that these things are understood and looked into. And I think, not that necessarily the pediatricians or general practitioners are negligent or not trying to do what they feel is best. So that maybe goes so, but typically it's more just a lack of awareness and lack of education. So
just don't know.
Mm-hmm. And it kind of comes back to a theme that I've heard in several of our presenters is that, as the parent, we really have to be willing to take on that role of being like the best advocate for our kid, to go beyond just what the first person perhaps tells us, explore, educate, learn. And that's a wonderful thing about the time we live in, because so much information is available to us. including, the stuff you guys provide on your website and then in the books and so forth.
Mm-hmm.
So I really appreciate you taking your time and sharing some of your great expertise and wisdom. And I know you mentioned there was something you had, if people wanted to go to your website, top 10 tips for thinking, sleep, so on and so forth. You want to tell us a little bit about that?
Yeah, if they go to my personal website, which is my health coaching website, which is my name, www.mariarickert, Rickert, Hong, Hong.com. There's a little form there where you can sign up for my top 10 tips for recovery. And it's just basic things. And you think, well, duh, does this really help? But they really do. And so, a lot of what helps your child recover are lifestyle changes and working through those kinds of things. And so, you might be able to have a child that thinks more clearly or has less constipation or sleeps through the night. My son was waking up 6 times a night, and I'm not a nice person when I don't get my sleep. So.
Not too many of us are, that's true.
Yeah.
Well, awesome. So they'll go to your site. We'll put the link below for that also, and they can find that there. Well, that's excellent. That'll be very helpful.
Yep.
All right. Well, thank you. I personally look forward to your book releasing, so I can take a look at that and educate myself even more on this problem and be able to help more people with that. So I appreciate it.
Sure.
All righty. Well, thanks so much. And also, we'll put all the links below. Obviously, everybody's going to want to keep up with what you guys are doing and so forth, as I will too. So thank you.
Great. Thank you.
Right. Bye-bye.
Bye.